I want you to listen to this. Medical debt is one of the leading causes of bankruptcy in America. Well, now Rock and Roll Hall of Famer Chuck D, rapper Fat Joe, and the Foo Fighters, as well as a lot of other people, are teaming up to help bring awareness to the issue of price transparency in the healthcare system. It's part of a push to get medical companies to share pricing with their patients prior to treatment. And joining me now is rapper Chuck D, and I'm so glad that you are here. Thank you so much. So a lot of the viewers will know that I grew up in Canada, right, where there's a public healthcare system. The concept of having to file for bankruptcy because of an unfortunate accident, because you sought preemptive care to get ahead of a medical issue, it seems so backwards to me. I'm curious about, because when I saw the list of people involved in this, and it's an organization called Power to the Patients, how did you get involved? You know, why did this ignite an interest in you?
Well, you know, it's important that artists speak for the people. You're always seen in front of the people in performances. They have people who are fanatical about the art and whatever. But when the cases of real people doing real things, sometimes it's best to connect to that. And it's just, it's almost like it comes to a moment, a critical moment where hip hop and rap music had its 50th year last year. So Power to the Patients saw that there was a connect of rappers who previously, maybe the rap industry, everybody was like, oh my God, how do we connect with it? And are they saying the right things or whatever? They were innovative in this approach of finding the faces and the voices that have been speaking to people so many years and connecting them to a cause that has leveled much of Americans over the past like 25, 30 years. And be able to make a point of the transparency, of course, leveling it out to the point where, you know, estimates are just not enough. Nailing the actual cost and being able to tell people that it should be fair and not throw people into the poorhouse of bankruptcy when they're trying to take care of themselves and health.
So let's talk about this, because we're not saying, you know, it would be great if healthcare was free or lower in cost, but what we're just saying is people should know how much they're going to have to pay before they agree to these services, right? So you've called this an American humanitarian crisis. How can this issue be tackled head on? What needs to be done?
Well, right now, kudos to the Senate. It's actually has been nodded in the Senate and so far, but you know, estimates are not enough. It's about nailing the actual costs and really being transparent about it. We as artists are very close to it because we're connected to our families and we're connected to communities who don't really trust government, don't really trust the police, and don't trust hospitals or doctors, and that has leveled us. So you want to be able to be on the up and up, and being able to have peers like Fat Joe, who's great at explaining it. Last night with Valerie June, Fat Joe, and then the Foo Fighters. So the artist community is going to actually put like a, you know, a large beacon or you know, a blowhorn to this, because real people have really been in the trenches of trying to fix this, and you know, big ups to Power to the Patient. So it's not a shill, we're not mercenaries. No, this is, we're connected, we're involved with this, and you know, I mean, from our moms to our kids, you know, to our spouses, this is real. You know, real life.
Yeah, so I don't know what's really involved when you say, you know, a big celebrity like you is working in conjunction with an organization. Clearly, it's something you're passionate about. Have you heard from patients? I mean, what sort of stories have you heard that really stuck out to you?
Stories that I heard is that when somebody goes in and finds out that they need a procedure and they might have paid or been told to pay like $1,000 or $2,000, and then somebody that they know in the same hospital has to pay $18,000 and is hunted down. Those are real stories that's popping up almost every day and every minute. So we have to stop that criminality, I feel, but, you know, when people say, listen, I can't afford to get fixed. At the end of the day, the mortuaries have the call on it, and we can't have that.
Right, and you know, we as a society pay one way or another. When people are afraid to go to the doctor, they don't get those early tests, so they avoid a health crisis later on down the road, which is going to cost a lot more. So it's great work that you are involved in. Chuck D, thank you very much.
I appreciate it, and speaking for all my peers and powertothepatients.org, you know, I salute them, and anytime it's something good, you know, it's good to pop up on your screens saying and doing the right thing. No big pun intended.
Puns are great. Everyone knows I'm a
Okay.
big fan of puns. Highest form of humor. Thank you so much.
Yeah.